Hi, my name is Dr. Katrina Bust. I'm a pain psychologist at the Oregon Health and Science University in the Comprehensive Pain Center. We are going to explore how your mood can have a big impact on the pain that you feel. Pain and mood are so closely linked. If you have had pain for a long time, naturally, this can get you down or make you worried. Also, you may be avoiding contact with other people and feeling more isolated or alone. These are very common experiences for people living with chronic pain, so you are not alone. But we have good news. While it might seem incredibly difficult to imagine feeling better, it is possible to make small, important changes that lift your mood and change pain over time with some learning and practice. It's worked for others, and I think it will work for you too. You are going to hear from healthcare providers about how pain and mood are connected. We'll explain how your brain and your body respond to stress and pain, and we will explain how you can change these responses. You'll also hear from people who have struggled with pain themselves, who will share their stories of challenges and successes, things that help them. We will give suggestions for changes you can start making right away. But first, let's talk about your experience with pain. Do you often get stuck with negative thinking and feel down or depressed? Do you get anxious about things and worry about them? Have you stopped doing the things that you enjoy? Do you avoid interacting with other people? Do you have a lot of tension in your body? Or do you feel like you have lost a sense of who you are? This is all very common when living with pain, so again, you are not alone. How does stress make pain worse? Pain and stress impact each other. Remember the complex brain map of pain? Stress, concern, and worry are part of that pain map. Stress has a direct effect on your body. And this is important because it is a key to change. So let's look at how this stress response works. Think about when you get startled or scared, say a bus is rushing towards you while you walk across the street. This activates your body to respond quickly to an emergency. Our brain doesn't know if this is a big emergency or a small one, so it gets us ready for anything. Fight, flight, or freeze. A small place at the base of your brain directs this response by producing hormones and other chemicals, so you will breathe faster to get oxygen to your heart, and your heart will beat faster to pump blood to your muscles, so you can respond to the emergency and get across the street safely. When you are stressed, your body and brain are on alert, ready to detect any threats and respond to an emergency. The brain may start to interpret chronic pain as a chronic stressor, constantly activating the body's emergency response. This is one of the reasons why pain can become chronic or persistent. This stress response can be heightened in people who have had experienced traumatic events in their past. This could include involvement in a violent crime, a serious accident, a war experience, an abusive relationship, or childhood neglect or abuse. These traumatic experiences can make a person more sensitive to possible threats around them. This cycle of ongoing pain and stress can lead you to feel helpless, overwhelmed, and exhausted. But you can change that. You can do a lot of things to quiet your stress. When you slow your breathing and relax your muscles, you slow your heart rate and quiet the stress response. When we quiet stress, we release other hormones and chemicals that calm our brain and body and can decrease pain. When we quiet stress, we feel that the world around us is a bit easier to be in, so our brains are less tuned to constant threat, and we quiet our pain. So while you can't always change the stressful things in your life, you can change how you respond to those things. This is one of the ways that the brain and the body rewire and change pain. How do we quiet stress? By learning relaxation skills, getting involved in activities that you are passionate about, connecting with others, and changing thoughts, emotions, and actions. This is not an on and off switch, but by making changes slowly and steadily over time, you can wind down your system and calm the stress response. Practicing relaxation called mindfulness or meditation can be helpful. Relaxation helps calm the mind and body, decreases pain, and improves mood. Mindfulness meditation is one strategy for promoting relaxation that is becoming increasingly popular as more and more people learn the powerful benefits of relaxation practice. The easiest way to do this these days is with a smartphone app. We give some recommended apps in the resource section. Get involved in activities you are passionate about. When you are in pain, you may give up activities or hobbies that are meaningful to you, and this can lead to feeling sad or depressed. Returning to activities you enjoy or finding new hobbies can give you a sense of purpose or pleasure and can decrease your pain and improve your mood. It's common to put off things that you enjoy with the idea that you will do them when you feel better. But actually, starting to commit to things you enjoy will help rewire your brain, and being more active will distract you, and often distraction itself can decrease pain. Spend more time with friends or family or find new social groups. It's natural to want to isolate yourself, but that is something that we know can increase pain. Think about connecting with people who can help encourage your progress or who are just fun to be around. This could be a child or a pet too. Reconnecting with your support system can decrease pain and improve your mood. Reframe negative thoughts. Learning to reflect on and reframe negative thoughts can decrease your pain and improve mood. Reframing means thinking of another way to say your thought. For example, changing the thought from, "My pain is overwhelming," to, "I'm having a flare-up and I am going to use my flare-up management techniques to get through it." Changing your thoughts and actions can help your mood a great deal. Feelings of sadness, worry, and fear are common emotions for people experiencing pain. These feelings can affect our thoughts. For example, "I will never get my life back, so I just won't do anything at all." This thought may lead to change our action, so we might stop socializing or walking. Cognitive behavioral therapy and acceptance and commitment therapy are common types of talk therapy where you can focus on changing emotions, thoughts, and actions to manage your pain. Most folks who struggle with mood and emotions do benefit from counseling or therapy because, hey, this is hard. Why not get some guidance along the way? Looking at the things that can affect mood and pain can help make sense out of it. When we break it down like this, we can see where we can make changes.
That I really was living in constant fear and a constant fight or flight, and I didn't know that I had been living like that for so long. I had the tools to help myself the whole time. I just didn't know it. I had the tools to be able to change my mindset around my pain. I had the tools to be able to talk my way into feeling better. One of the things I really use is positive self-talk. It's a very strange thing to do, and it's hard to get into, and it's hard to practice, but it really works.
Pain management is being able to also pay attention to the stimuli that are going to affect my mood that are eventually going to cause a migraine. So looking a couple steps ahead to figuring out what is the source that is causing me so much anxiety or stressing me out, and how can I alter my relationship to that stimulus.
Well, what I'd like to say to others is don't ever give up on yourself. Find people and medical professionals who will see you and hear you and respect you like you've done for me. And find people to work with who understand pain science.
Could you talk a little bit about what the small steps and small gains in life have meant for you?
They mean everything. I get to do things in a better way, in a more positive way that I've never had the ability to do before.
Try to find things that bring you joy. I'll go to a local coffee shop and I'll sit there and I'll write. And I always run into a friend. You know, there's always something social. I'm with other people. I might not be engaged with other people, but I'm not isolated.
Right.
We never have to stay in the negative. We can always find a way to turn it and make it positive.
So we learned about how pain and mood work together and considered some ideas that can help you move towards change. Here is an example of a short-term goal and some steps to improve your mood. My goal for the next 2 weeks is to practice relaxation skills, focus on being more positive, and do more fun things. Here are some specific steps I will take. I will call my friend that I have not seen in a year. I will get to the yarn store so I can start knitting again. I will practice relaxation for 10 minutes before going to sleep at night. I will download an app to help learn relaxation skills. I will try to catch myself when I hear negative thinking and reframe my thought to be more positive. The most important goals to focus on are the ones that feel important to you. So we talked about learning relaxation skills, doing the things that you enjoy, connecting with others, changing thoughts, emotions, and actions, and counseling such as cognitive behavioral therapy. Many people like you have made meaningful changes to their lives and have taken the small steps to start to feel better. And you are much more than your pain. It's important to recognize each step. They all add up. Taking small steps can get you back in touch with the things you enjoy and can decrease your pain. And remember, this is a process, so be patient with yourself and celebrate each step. No matter how small, they all add up.